The topic for this video is BPH, also known as benign prostate hyperplasia. Benign essentially meaning that it's not cancerous. Prostate is the organ that it affects, and hyperplasia is just a term that means an increase in the number of cells. And let's get started. And we'll refer to this as BPH throughout the video for obvious reasons. So I think a picture is probably the best way to start off talking about this. So as you can see, let's look at this part of the diagram. There's a prostate here that is pointing to, and if you can, I don't want to draw too much here, but if you notice, this is the bladder, and this is the bladder, and the urine normally sits inside the bladder, and eventually the urine exits the bladder through this canal known as the urethra, and the canal eventually empties out through the exiting point of the male penis. Now, the canal, when the prostate is normal, is nice and patent, as you can see. But let's turn our attention to what happens when you have a enlarged prostate. Well, the diagram is a very nice description illustratively of what happens. As you can see, that canal known as the urethra is significantly narrowed, and that's what causes the symptomatology. And those symptoms include essentially the symptoms of bladder obstruction. Instead of memorizing what the symptoms are, think about what's happening. The bladder essentially just can't empty the urine like it used to. It can empty a little bit because there is a little bit of patency in that urethra, but not as patent as when the prostate is normal. So with that in mind, what are the symptoms? Well, the symptoms are, the way you want to think about it is that the prostate is squeezing that urethra, and as a result the bladder is not able to empty the urine. So those symptoms will include incomplete emptying of the bladder. That makes perfect sense. And as a result, you're going to go to the bathroom a lot. Frequency, you empty a little bit, then you go back, empty a little bit, things like that. That's what frequency. Urgency, meaning all of a sudden you have this tremendous urge to go because you simply didn't empty your bladder. There's a long list of symptoms, but I want you to understand them rather than memorize them. You can also go to the bathroom at night a lot, which is known as nocturia. After you go, because your bladder hasn't emptied, you can have dribbling also. Now, these are very troublesome, sometimes embarrassing symptoms that men can have. So that's why BPH is so important. It's also extremely common. There's a saying that 90% of 90-year-olds have BPH. So that's just because the prostate grows in all men as the man increases in age. Normally BPH happens when the person is in the 50s and 60s or beyond, but it can happen in a large number of men over a span of several decades. Okay, so somebody has come to your office and they've basically told you that they've had these symptoms. How would you go about diagnosing it? Well, the diagnosis involves a couple of physical exam points and a couple of lab tests. So the physical exam involves the digital rectal exam. Digital refers to your digit, your finger, and also known as DRE. And that's basically a prostate exam where you insert your finger and you feel the prostate. And if the prostate is indeed significantly enlarged, you can feel that. You can feel the prostate to be enlarged or even hard or irregular in nature. The other thing you can do is you can palpate the bladder and if the bladder is significantly obstructed in its outflow, then the bladder could be distended. Labs, well, the big test, PSA, everybody's heard of this, prostate specific antigen, and that tells you about prostatic hyperplasia, and the normal value is less than 4, and the units for this is nanograms per milliliter, just to make sure. Greater than 10 is considered abnormal, and if it's between 4 and 10, that's sort of known as the gray zone. And what that means is that it's not technically abnormal, but it's not normal, so it probably needs further investigation. One more lab test that's commonly done is a urine analysis. That's to exclude any urinary tract infection. And then finally a bladder ultrasound. That tells us how much urine is still in the bladder after the person goes to the bathroom, and it can be a very good test to figure out the extent of bladder outlet obstruction. And then what you do to actually figure out if there is any kind of malignancy in the prostate is a prostate biopsy. And prostate biopsies are done in a urologist's office. Urology will do prostate biopsies. So. All right. So how do you treat BPH? What's the guidelines? Well, there's medications and then there's surgery, meds and surgery. Now the surgery essentially is involving resection of that enlarged prostate, and the term is TURP, and TURP stands for transurethral resection of the prostate. So transurethral meaning you go in through the urethra here, and then you resect out the enlarged portion of the prostate, and that is a surgical procedure done. Now the medications, there's two big ones, and I want to talk about both of them. Alpha-1 adrenergic blockers, and the next one is a 5-alpha reductase inhibitor. I'm going to explain what each of these does. Alright, the first one, the alpha-1 adrenergic blockers, those all usually end in osin, zosin or osin. So for example, terazosin, the very common one. Now how do these work? Well, what's 5-alpha-1 adrenergic? These are receptors. Alpha-1 adrenergic. These are receptors. That's what you're blocking with these medications. And these receptors are on the smooth muscle and the smooth muscle of the bladder and prostate, and also in the arterioles. So when you block these receptors, what you get is a relaxation. When you block relaxation of that smooth muscle, and what that results in is dilation. So what that means is that that lumen starts to open up. So for example, this lumen here, this lumen starts to open up, and that relieves the symptoms of BPH. Now interestingly, because it allows the relaxation of the smooth muscle in the bladder, neck, and prostate, it's used for BPH because it opens up that lumen, makes it wider so that urine can flow through. But also, if you notice, these receptors are also on the arterioles, so it also widens the arteries and as a result you get a vasodilation of the arterioles, which results in reducing blood pressure. So these medications, if you look them up, they have two reasons why a person will be taking them. The first reason is BPH, and the second reason is hypertension, interestingly, because it causes vasodilation of the smooth muscle of the arterioles as well. Now let's look at the second class of medication, which is known as 5-alpha reductase inhibitors. Well, there's a chemical pathway in the body which converts testosterone to DHT. DHT is a substance that is involved in promoting prostate growth. So that's this is the bad guy. I guess this is what's causing this to happen. Prostate growth. Promotes prostate growth. And the enzyme that causes this conversion is 5-alpha reductase. So when you have a medication that is known as a 5-alpha reductase inhibitor, it blocks this enzyme. And one of those is finasteride, for example. That's the name of a medication that's a 5-alpha reductase inhibitor. So when finasteride blocks 5-alpha reductase, which is an enzyme, it reduces the conversion of testosterone to DHT. And if you have less of DHT, you have less prostate growth. So that's the other way that it's that's the other medication that's used to treat BPH. And then finally, I just have a quick clinical vignette, nothing too complicated. 55-year-old man presents for a routine physical. His blood pressure is 161/98, so it's a bit high. Patient's only complaint is that over the past several months he has had difficulty urinating. His urine stream is intermittent, and he has recently begun experiencing nocturia, urinating at night, and profound urinary urgency. Digital rectal exam reveals diffuse enlargement of the prostate. Which of the following agents would be most likely to effectively treat the man's urinary tract symptoms as well as his hypertension? Well, we talked a little bit about those medications that are known as alpha-1 adrenergic blockers, and that if you were to block those alpha-1 adrenergic receptors, it causes relaxation of the smooth muscle in the bladder, neck, and prostate. And that's why those medications which end in zosin are used to treat BPH. But also, those alpha-1 adrenergic receptors are also found on arterioles. So when those receptors are blocked, they cause vasodilation of the arteries, which results in lower blood pressure. And that's why those medications are used to treat BPH and hypertension. And of these 5 choices, it would be choice E.